Hello, let's learn about infection control and immuno. To understand by immunocompromised states, it indicates impaired phagocytic function and number, with evidenced by neutropenia and steroid users, and then impaired cellular immune response, evidenced by kidney and other organ transplant recipients, steroid users, AIDS, and antiviral barrier due to solid organ transplant. So we see nosocomial infections in as a opportunistic infection and community acquired infections in immunosuppressed patients. The nosocomial infections include viral infections like HSV, then hepatitis B or C, then bacterial infections, then fungal infections like Candida infection, parasitic infections. While the opportunistic infections include cytomegalovirus or Epstein-Barr virus or varicella zoster virus, RSV and others. And there is a list of infections because of nosocomial state or opportunistic or community acquired in immunocompromised. The spectrum of infections in immunocompromised, if you see the it was in a study, it was observed that around 127 infections occurred in 65 patients, and 68% of UTI, that is 47%, occurred among 31 patients. The 16 were recurrent UTI, 8 were bacteremia, 6 were caused by gram-negative bacilli. Viral infections were evidenced in 17% of the patients, pneumonia in 8% of the patients, and surgical wound infection in 7%. Refer to the details in this article. So the spectrum of infections is varied in immunocompromised, mostly because of the opportunistic infections by gram-negative viral infection. Now, what are the factors that affect the state of the immunosuppression? It is the immunosuppressive therapy, the underlying immune deficiency, the integrity of the mucocutaneous barrier, the debridized tissue, fluids collections, neutropenia, lymphopenia, and metabolic conditions like uremia, malnutrition, diabetes, and infection with immunomodulating viruses such as CMV, Epstein-Barr virus, hepatitis B and C virus, and HIV. Let's see about healthcare associated infection. These are the infections which occur in the patient during the process of care in the hospitals. And it can be endogenous or exogenous, and these are very common in immunosuppressed patients. The endogenous sources are body sites such as skin, nose, mouth, GI tract, or vagina. Or exogenous sources such as patient care, personal visitors, patient care equipment, medical devices, and how does this infection get transmitted to the susceptible host in this circumstances, the immunosuppressed host? It's through three modes of transmission, either by contact or by airborne or through droplet route from the reservoir. So to prevent this transmission of infection from the reservoir to the host, we have to apply transmission-based precautions such as airborne precautions, contact precautions, and droplet precautions. Let's understand the difference between airborne and droplet. Airborne particles are less than 5 microns, while droplet are more than 5 microns. This airborne spreads more than 3 feet distances, droplet spreads less than 3 feet. They are suspended for longer duration, while they are suspended for lesser. The precautions include N95 respirator, mask, and negative ventilation, where herein healthcare professionals should wear a mask. Examples of airborne infections include tuberculosis, measles, chickenpox, and others. While examples of droplet infection include diphtheria, pertussis, meningitis, and others. What are the precautions for contact infections, which spreads a direct contact like from to patients or healthcare professionals? We, there is a direct physical contact and which spreads by transmission by shaking hands, giving the bath or inspection, palpation, percussion, and during auscultation. And examples of infection get transmitted by direct contact include staphylococcus infections and HIV, HBV, and hepatitis. To indirect contact, it's through medical equipment from the healthcare professionals and it includes examples of organisms infections because of organisms like Salmonella, Pseudomonas, Acinetobacter, and others. Then droplet infections include infections that are transmitted by droplets, and this includes influenza virus, dysentery, meningitis, and others. Mycobacterium tuberculosis, Legionella. By the vehicle, that is food, water, medication-borne infections include Salmonella, HIV, HBV, and gram-negative bacilli. They get transmitted by drinking or contaminated water or unsafe injection and others. Herpes zoster, let us see the infection, the precaution that should be applied. For example, for herpes zoster, standard precautions and airborne precautions needs to be followed. This is disseminated. Exposed healthcare worker or the patients needs to have herpes zoster virus immunoglobulin and vaccine. All healthcare workers without protective antibodies should receive 2 doses of vaccine. And exposed professionals should be monitored starting from day 8 after exposure for possible disease. Large outbreaks occur among patients of hepatitis B and hepatitis C. The primary reasons are because of the reused needles and single syringes to now. So the safe injection practice needs to be followed for the same. Now for mask needs to be applied while during specific lumbar puncture procedures and central line placement, because they limit the dispersal of droplets. Respiratory hygiene needs to be followed because they reduce the spread of microorganisms that is turn head away from while coughing, sneezing, cover the nose and mouth with a tissue. The first principle of infection prevention is to immunosuppressive place that 30-40% all healthcare are associated with 5 practices like use of catheters, vascular lines, therapy of pulmonary infections, surveillance, and others. We'll see in details in next session. Thank you.